only 5 minutes Charcha. It's already tea time on Dydrogesterone 30 milligrams sustained release tablet. I can see it for the last 2 months. This particular tablet is there in the market. 3, 4 drug houses are promoting it, and we do not know what to be done. So I brought it, especially now. So many experts are there. There are already 50 people have joined up the session. I will definitely like them to throw some light on it. Now, these are the indications which are been approved by the DCGI as for the dydrogesterone 10 milligram tablet is concerned. I know that dydrogesterone has been there in the market for almost 60 years, and many people have used it. So the majority of the doctors which have been using dydrogesterone is for infertility, luteal phase support in ART. They are using in luteal phase insufficiency, which is hardly ever diagnosed, treatment of recurrent miscarriage and treatment of threatened abortion, though it has been prescribed for endometriosis, for irregular periods, for dysfunctional uterine bleeding, for premenstrual bleeding. But what we gynecologists are familiar are with the last 4 indications. Now, dydrogesterone SR, few companies asked for permission from the Drug Control of India, and this was outright, all the indications were not permitted, and finally it was said, we give you a preliminary permission to give it as a treatment of endometriosis, and then same time you have to do stage 4 trials and then come back to us. So this dydrogesterone SR 30 milligram tablet, which is available for everybody who is listening me, is approved for endometriosis associated pelvic pain and endometriosis. And this is an extended release tablets. But I find, these companies are promoting it for ART, luteal phase support. They are promoting it for recurrent abortions. They are promoting it for threatened abortions. So I think, that brings me that we ask Guru of Guru as far as IVF is concerned, what is his opinion about things, what should be done about this. So I think, I will like to have comments when they are people go overboard when the drug comes in the market. And the gynecologists are not in habit of reading themselves, and that is why they are carried away. They says, "Bhai, 3 बार लेने के बदले है कि उसको एक ही बार लेने में काम चल जाए." So I think, I will ask Brigadier Sharma, what is his opinion about it? I have just brought you what DCGI has approved, what the DCGI has not approved. But you, आपकी क्लिनिक में भी, जैसे मेरी क्लिनिक में ड्रग हाउसेस वाले आते हैं, वो उसको बोलते हैं, डॉक्टर साहब इसको आप ART में भी यूज कर सकते हो, डॉक्टर साहब इसको आप रिकरेंट अबॉर्शन में भी यूज कर सकते हो, डॉक्टर साहब इसको थ्रेटेंड अबॉर्शन में भी यूज कर सकते हो. सर, I would like to have opinion from you.
Yeah, madam, actually, if you look at the formulation, this chemical is being used for so many years. So by dydrogesterone itself, is a safe drug. We all know it. And the 10 milligram, twice a day we have been giving, thrice a day we have been giving. So it has never created a problem. Now the thing is, we have to go with what the government allows us to do it. Because in case the government has given only for endometriosis, and if we use it in a say case of pregnancy where we are giving 3 times a day, instead of that it's okay to reduce the number of doses, we give 30. God forbid something happens to the baby, some abnormality, and the patient may go to the court against us that drug was not proven, given approval by the DGCA. And the doctor gave me this medicine, and that is why my baby has got this abnormality. So that problem can happen. So I think though the company would say maybe in threatened abortion, I would not like to give it at present unless the government says. But DUB or other places where the second patient is not there, the embryo is not there. That only one patient is there. But in pregnancy, there are 2 patients. One is going inside the uterus. So they are more worried to do anything which is not approved by the government or by DGCA. And for endometriosis, yes, I will give it, and for DUB, I may give it. But then there are cheaper, versions of this progesterone for DUB. Then why should I give this progesterone for that matter? So as on today, I have not started in my practice to give it to my infertility patient unless the DGCA gives approval for that purpose. I give the 10 milligram 3 times a day. So, but logically speaking, there doesn't seem to be any difference. It is sustained release, and it is 30 milligram. Anyway, I'm giving 30 milligram, which is not sustained release. But just because of medical legal issue nowadays, because everybody is against the doctors, so we have to be very, very careful. Whenever we prescribe any medicine, which has not approved by the DGCA. But
Thank
logically,
you
I
very much,
can
sir.
consider the
Yes.
medicine.
I,
Logically,
I can see here Dr. Arora here, who is a chairperson of president of Delhi SR, and Dr. Jyoti Malik, who is also the president of Rajasthan SR, and even Shalini. What are your comments about this?
Ma'am, to be very honest, in my IVF practice, dydrogesterone and all, my preferred choice of drug is still the micronized vaginal progesterone or vis-a-vis injectable progesterone. And when I was going through the guidelines also, in fact, the ASHRAE guidelines also do not recommend these kind of oral dydrogesterone as the drug of choice for luteal support in IVF patients. And coming on to the new drug, which they have come up as the 30 milligram sustained release tablet, I still would say it is a new drug, and we do not have so much of data on this that we stand alone as we start writing, we start prescribing this drug. In fact, there has been two major trials which have been done comparing the efficacy of this is I'm talking about the 10 milligram. The Lotus 1 trial compared the vaginal gel versus dydrogesterone, and Lotus 2 trial
No,
which they
no, Shalini.
compared.
Focus only on the sustained release. Your comment should
Yes,
be on the
ma'am.
sustained release.
Yes, so sustained release as of now, madam, I am not recommending it to my patients. Still, I am convinced till the government guidelines give us the approval. I would not prefer to use it right now as of now, the current status in my practice, ma'am.
Dr. Jyoti Malik?
Ma'am, the company has recommended only for endometriosis per se. So for endometriosis, we can use this as a.
I have seen it.
No,
I have
Dr.
seen
Jyoti,
it.
they are coming to us as a.
They're coming this. They're
yes,
telling for आप IRT में भी use
yes,
करिए, आप recurrent precaution में भी use करिए, आप
हाँ,
इसमें भी use करिए.
yes,
But
they are coming to us.
They are saying, but we should not use it unless it is approved by DCGI for ART purposes.
Yes, so
now,
I think the
for the
message is
time being,
clear.
they are giving only for endometriosis, so we should use it for that. But for ART purpose, it is our responsibility, as Sir rightly said. If anything happens, the patient would always be on our head. So why use it? When we are using 10 mg TDS, let's just keep using that until we have proper guidelines or approval by DCGI for our IVF purposes. But I think only the company and the papers say for endometriosis as such.
Mm-hmm. No, in fact, these company people, they
Thank
do
you.
show us the data, they
Yes.
show us the papers, this study and this study has been done. But I think as of now, since the unanimous decision as guided by ma'am, sir and Dr. Jyoti Malik, is the unanimous, I think the decision would be that not to write as of now, especially for our ART patients. Over to you, ma'am, Sharda ma'am.
I think Dr. Sunita is not there, but anybody wants to comment on this particular thing, we'll be happy to listen before we close. Anybody wants to say? Yeah.
Dr. Seema Sehgal, Dr. Sujata. Dr. Sujata,
Unmute.
I think we should not be influenced by these medical reps who come and teach us. We should have a proper guidelines. Only then we should start using them in pregnancy. And,
Dr. Jyoti, I
also think about cost.
Hello,
yeah,
Dr.
Dr.
Jyoti.
Seema.
Though it's
please.
good,
Yes,
it's very good that it's a sustained release. It will definitely, if it is effective, It is very good for the patient to reduce the number of time doses. But the thing is, we don't know the how much blood levels it is able to maintain. So if we are using it in association with, because I have seen that IVF patient, they are on injectable sustain and vaginal sustain and everything they are taking. So in that case, I think we can try if we have given patient too many drugs. So I think I want to try. I definitely like to try once. Okay,
Madam, it has
just
not
to
been
reduce.
approved, Dr. Seema Saigal. You must follow the law of the land. And if a doctor
If
who
it
does
is
not
not
follow the law
approved,
of the land is not
definitely,
right. Yeah?
definitely I should not. That is okay. If it, then to ma'am, if there is no question arises,
It
then
is
we should
only
not try.
approved for endometriosis, and still they have to produce a
And yes, yes.
stage 4 trials. They have to produce in front of it for final approval.
Then to is there is no question, ma'am. Then to is done. Just
And yeah, and then what I
unanimous.
was talking about, I mean, I though definitely I was talking about the 10 milligram tablet, but even the my point of saying was that even the HRA guidelines do not support dydrogesterone as the first line of progesterone support. So where does the question of 30 milligrams comes when even 10 milligram
We are giving
TDS
it
is also
more
not?
for immunomodulation, Dr. Shalini. We all use Naturogest and Dydrogesterone, both of them we are using
Yeah.
more of as a immunomodulator rather than.
True. But the first choice, I think even yours would be the micronized progesterone.
Shalini,
I mean,
you
Yeah,
are
yeah.
deviating from issue. You're
Yeah,
deviating
yes,
from
ma'am.
issue. The
this
issue
is
is
another
30
Okay.
thing.
milligram.
Yeah. True, ma'am.
Okay?
True.
Hello?
Wind up,
Yeah.
madam. Wind up.
Okay. So with this, I think we wind up this interesting webinar with so many take-home messages we have taken. And thanks to all the speakers, Dr. Sujata, Dr. Jyoti Malik, and Sharda Jan ma'am for giving us wonderful and crisp talks, and Dr. Brigadier Sharma sir, whose inputs we always cherish. We learn so much, and I hope all the delegates have been benefited by this. And sincere thanks to all the chairpersons also, Dr. Seema Sehgal ma'am and Dr. Ashna Pathak ma'am, and sincere, very special thanks to Sharda Jan ma'am for